Namaste. I'm Dr. Shwetha. I'm an obstetrician and gynecologist. I'm a fertility consultant as well. I practice at Janisthaa Fertility Center and Hospital, which is located at Basaveshwar, Nagar in Bangalore. I'm the managing director of Janisthaa Fertility Center and Hospital. Janisthaa. Why Janisthaa? What does Janisthaa mean? Janisthaa means desire. Most of the people come here with a desire to conceive, and that is why we chose the name as Janisthaa. Infertile, infertility, or subfertility, these are the kind of words which would hurt anyone. Now, how do we know whether the person is going to conceive at a normal time or if there is a delay in conception? Generally, after marriage, and when the couple is trying for pregnancy continuously for 12 months, that is 1 year of time without any protection, the pregnancy rate in such couple is as high as about 70%. So that means if a couple is trying for pregnancy for 1 year continuously, the pregnancy rate is as high as 70%. Now what happens is the following 10% will conceive in the next 24 months, that is the next 12 months, where 80% of them conceive. Now the remaining 15 to 20% of the population which has been left behind, these are the people who would have difficulty in conceiving and they need evaluation. First of all, the couple should be having adequate intercourse, proper intercourse. So there are a lot of people who come here and upon history taking they reveal that the intercourse is not proper. So when it is not happening, then pregnancy chances also would decrease in them. If everything is okay and if they're having adequate intercourse, and despite that if you're not having pregnancy, then we'll have to go ahead with evaluation. Now how do we evaluate basically when they come in the first time? So we do a scan and see what is the size of uterus and how is the endometrium and how are the ovaries looking, how many follicles, that is the antral follicle, what count is there. We will all check in the women and see. And accordingly, we do the hormonal tests like FSH, LH, E2, thyroid levels and prolactin levels and see if everything is hormonally okay or not. Similarly, in men, we do semen assay. So the semen analysis. So what do we do here is we check for the count, motility and the normal looking sperms. So when all these parameters are normal, then only we call it as normal semen assay. And there's one more test where we check for the fallopian tubes. Fallopian tubes are the tubes which are next to the uterus, and this is where again the sperm meet and form embryo. So if the tubes are blocked, then again the sperm can't meet and it won't result in pregnancy. So we do the tubal analysis by doing a HSG, that is called the hysterosalpingograph, or by laparoscopy, where we assess the tubes whether it is open or not.